Waitematā DHB concedes it's had complaints about ill-fitting masks that are supposed to protect staff from Covid-19. The DHB's launched an investigation into the use of PPE or personal protective equipment after 3 of its nurses contracted the virus. It's stood down 57 staff and is tracing everyone who's had contact with the infected nurses. According to the DHB, the nurses had access to full PPE and it was worn at all times. Waitemata's DHB's Deputy Chief Executive, Dr Andrew Brant, says he doesn't yet understand how this has happened.
We have got to learn from this. It is clearly having 3 staff contract COVID means that there is. We need to understand why that has happened and what else we need to be doing to help prevent such future things and such things again in the future.
Were those 3 staff, had they been fitted for their N95 masks, which I understand is a requirement?
Look, I understand that there is fitting for all the staff that who need to utilise N95 masks.
So can you tell me for sure whether these 3 nurses had their fittings for the N95 masks?
That is my understanding, but I can absolutely clarify that for you in the future.
Okay, because we have heard, Checkpoint has been told by nurses working within the DHB and other staff that there has been ongoing concern about ill-fitting N95 masks. Are you aware of those concerns?
I understand that we go through a process of that concerns have been raised around N95. We try and address those directly with the staff that have raised those concerns.
What
concerns have a whole procedure,
specifically have been raised with you?
As you say, about saying whether they are appropriately fitting. But we have a process whereby staff come and actually get a fitting procedure done for their N95 mask, and we then find the right appropriate mask for that staff member.
How many complaints have you received about ill-fitting N95 masks?
I'm sorry, I couldn't tell you how many complaints I've had regarding ill-fitting masks.
Were any of the staff who have become infected concerned about ill-fitting masks, or is there any suggestion that their masks were ill-fitted?
There hasn't been any suggestion that they were ill-fitting from these 3 affected staff, and I am not aware that they have raised any concerns around the mask.
Another issue that has been raised with us is there appears to be confusion within the DHB and mixed messages from occupational safety regarding what masks are to be worn when, and that there is little or no consensus on whether to wear a surgical mask or a fully fitted N95 mask. Have you given staff a clear directive?
We have given very clear directive informed by the national guidance around what PPE we should be utilising for staff utilising within our hospital environment. And we have given clear guidance regarding that. We've given clear training. We have materials training materials as well. Yes, I think we have been clear about the appropriate PPE and the appropriate clinical circumstances within our hospital environments and community.
How much training had these nurses had in the use of PPE?
Look, I think we are undertaking a full in-depth review regarding these 3 incidents, and we should have more further clarity around that in the upcoming week.
Well, how much training do nurses working on COVID wards or doctors, how much training will they have had in the use of PPE before they're sent onto a ward with a COVID patient?
Well, they have training on the appropriate fitting of masks, if it was in N95, and also training on actually putting on, doffing on, and taking off the PPE equipment.
How much do they get? What, a half-hour tutorial, 1 hour, 3 sessions? Give us a bit of an idea.
It is usually just one session, but then the other important thing.
And how long would that session be, Doctor?
I'm not certain exactly about the length of time. I think it's roughly half an hour we'd be probably talking about, but I'm not certain about the length of time, and I can get back to you regarding that. But the important thing we do that once actually people are working on the wards, we actually have an auditing process that's underway. So for example, in the affected area I'm talking about, every day, every practitioner is actually audited about how well they're putting on their PPE, and we actually record that. at the time. So we take the PPE and the training and the auditing to ensure that appropriate PPE is undertaken.
So given that you have 3 staff who apparently were wearing PPE properly, from what you are saying, and had N95 masks, yet still got infected with COVID-19, what immediate steps have you taken to ensure the safety of your other staff? Because it appears that, well, even if they wear PPE, they could be infected with COVID-19.
Well, as what we're doing at this point is that we have immediately undertaken, locally within that environment, we've actually tested all the staff, for example, for COVID-19. So we have, in that whole wider area, we have tested roughly 140 staff to make sure that no one else was affected. We've yet to get all those results back, for example, and but we are planning to actually test everyone in that area.
Are you refitting masks or checking that they know how to use the equipment properly? Have you given any additional training sessions or checked the N95 masks of your staff?
We haven't done additional training sessions. What we're doing is that we have urgently undertaking a review of these cases to try and fully understand how the 3 staff could have contracted it. So at this point, I think that is speculation that it is around PPE. At the moment, we just need to really complete that review.
Is it an independent audit being conducted by someone from outside the DHB?
At this stage, it is an internal audit about actually looking about the nature of the about how potentially the 3 staff members contracted COVID.
Do these nurses socialise together outside of work?
I don't really. I think what we our advice to all our staff is that we need to be following good social distancing, as everyone should be doing outside the workplace. But if there were any issues regarding that, we'd expect that to arise in any review.
So ultimately, these nurses have not been kept safe at work. So who or what has let them down?
Well, that's why we need to understand fuller about why this has occurred. That's why we have looking into this by undertaking the review. It will take us a little bit of time to just get through all that detail and fully understand this issue.
And that is Waitematā DHB's Deputy Chief Executive, Dr Andrew Brant. And the DHB has come back to us to confirm that staff get 1 PPE training session. That session is half an hour long in addition to the fitting of their masks. And they cannot confirm exactly how many complaints they have received from staff about ill-fitting masks.